Thank you very much, Madam Speaker. It's so great to see everyone tonight. It's an interesting debate. It's a lot nicer in here than it is outside at the moment, so I'm glad to be here and honoured to be here to debate this important legislation about the future of changes to health care. Now, Madam Speaker, I don't think anyone would tell you that our health care system is working the way we want it to right now, Madam Speaker. Emergency rooms are backlogged, causing those in need to wait hours and hours and hours to see a doctor. The backlog in our emergency rooms is causing offload delays with our ambulances. Because when an ambulance arrives at a backlogged emergency room, the paramedic has to stay with their patient. And that in turn means that ambulances aren't out on the road helping those who are calling 911. Of course, when there are no ambulances left, this is called level 0. Now, the City of Ottawa's Emergency Preparedness and Protective Services Committee was told last week that there were 1,819 level 0 events in Ottawa in 2022. 1,800 times last year, the Ottawa paramedics had no ambulances to respond to 911. That's more than double the number from the previous year. And of course, Madam Speaker, when there are no ambulances in Ottawa to respond to 911 calls in Ottawa, 911 deploys the ambulances from Renfrew. They deploy the ambulances from Kemptville and Arnprior and Hawkesbury and Rockland to service the City of Ottawa, Madam Speaker. So this is not just an Ottawa problem, this is an Eastern Ontario problem, and it's caused because of the backlog in our emergency rooms. We also know, Madam Speaker, that millions of Ontarians don't have access to a family doctor. This is a problem that's only getting worse. 400,000 more Ontarians don't have access to a family doctor last year when compared to when this government took office. And so millions of Ontarians don't have access to a family doctor. When they go to the emergency room, they end up waiting hours and hours and hours. And when they call for an ambulance, there is a growing likelihood that one won't be available to respond to them in their time of need. So no, I don't think any Ontarian would agree that the healthcare system is working the way they would like it to. The question before us really should be about how to solve these problems. How do we improve and guarantee primary care access to a family doctor? Now, we figured out how to guarantee access to schools, but we still haven't figured out how to guarantee access to family doctors. And that's a problem, Madam Speaker. Now, there is also certainly a problem with surgical backlogs and surgical delays. Doesn't mean that what the government's proposing is the solution to that problem, though, Madam Speaker. Now, there are some over here to my right that think that operating rooms should run 24 hours a day, 7 days a week, like some kind of assembly line. And while I have no doubt that you can get a little bit more efficiency and capacity out of operating rooms in a hospital, it's not at all clear to me that you can get the amount you need to really address the problem that exists. The hospital CEOs that I've spoken to are very open to the idea of moving some elective, at least non-critical surgeries out of hospital. For many, if not most Ontarians, what they care about the most is access is timely, that it's as close to home as possible, that it is, of course, safe and professional, and that when they leave, Madam Speaker, they pay with their green health card, not their gold or their platinum credit card. Now, there are some that are ideologically opposed to that entire idea. But ideological entrenchment won't help us solve the healthcare crisis we're facing. Everyone needs to take off their partisan blinders so that we can offer Ontarians the best guaranteed and universally accessible healthcare services possible. Now, what I'm worried about in this legislation, Madam Speaker, are the safeguards. Are the safeguards in place to ensure that facilities are safe and professionally operated? Are the safeguards in place to ensure equal access is guaranteed, that Ontarians aren't asked to pay out of pocket for services that would otherwise be covered by HOHIP in some other setting, that there are not pressure tactics employed to receive medically unnecessary but profitable services and procedure? Those are the types of safeguards we need to see, Madam Speaker. Those are the types of questions I hope that this government will answer throughout this process of debating this legislation and the committee hearings that I'm sure will follow. Those are the questions that we'll be pressing the government to provide answers to. Thank you, Madam Speaker.